This is chapter 12, disordered eating. Right, in this chapter we're going to be talking about eating disorders, which is a really sensitive topic. I actually traveled several years ago and did conferences on eating disorders because in my industry, in the fitness industry, and probably perhaps a lot of the industries that you're going into, eating disorders are at an all-time high, especially among fitness instructors, fitness trainers. I mean, you would think that we would know better. You'd think that we would understand nutrition and proper nutrition in the body. But I think with all the added pressure of trying to be a certain image or a specific image, that it just puts more stress on us to maintain that perfect image. And so that can often lead to disordered eating. And it's very important that you understand what an eating disorder is, not only for yourself, but for those clients that you may often work with within your profession in exercise science. So for some people, a preoccupation with food and weight can lead to obsessive proportions and disrupt healthy eating behaviors. When this happens, we call that disordered eating. And this is where irregular eating, consistent undereating, or consistent overeating results. Disordered eating behaviors are very common when stress arises, illness, or just your dissatisfaction at your personal appearance. Under disordered eating, this is typically something that doesn't persist over a long period of time. After you get through the stressful event, or you decide that you've reached a weight for a specific event that's coming up, maybe a wedding or prom, then you go back to normal eating. And so we call that disordered eating, but it's something that doesn't persist. When the extreme disturbances of eating behaviors persist over a long period of time, that will lead to an eating disorder. I have my master's in counseling, and so I worked with quite a few clients that had eating disorders during that time. And it's very interesting to me to note that by understanding and being aware of what a disordered eating pattern is, you can actually prevent getting to that stage of a full-out eating disorder. Because once you get to that stage, it's like any other disease. It's very, very hard. It takes a lot of counseling, sometimes outpatient, inpatient therapy to overcome that eating disorder. So as we go through this chapter, I want you to really think about the signs and symptoms of eating disorders, and if you recognize those in yourself or in other clients, try to catch those sooner than later so that it doesn't become a full-blown eating disorder. Unfortunately, the eating disorders have really increased over the last 25 years. Approximately 8 million girls and women, and some men, also suffer. The rise of eating disorders in men has also gone up and suffered from this disorder, and especially prevalent in young girls. And some of these disordered eating can even start happening as young as 4th grade, which I know is crazy to think about. But even at a young age, girls are starting to alter their eating habits in pursuit of that perfect image. And I think a lot of that comes from social media. And unfortunately, it makes us think we have to look a certain way. And it propels us into this altering and unnutritious eating habits. Talk about some of those specific diseases that are associated with disordered eating patterns. And we'll get into more detail throughout this chapter. But you have anorexia nervosa with binge eat purge type, bulimia nervosis, binge eating disorder, and restrained eating. Now, I do want you to note that a lot of times we look at the top two, anorexia nervosa and bulimia, as the major eating disorders, But in the recent years, there is also eating disorders that are related to binge eating and also eating disorders relating to restrained eating. So I want you to kind of note those because those are a couple of disorders that have been added and that we need to be made aware of. And a lot of times we don't look at binge eating or restricted eating as a disorder, but it definitely can be and can lead to these other types of more extreme disorders. So you have a really extreme behavior usually associated with these, like excessive exercise, self-induced vomiting. Those are all some extremes you can go to, and we'll talk about that in a little bit more detail. Let's talk about anorexia nervosus. All right. Right here, in anorexia nervosus, it's an irrational fear of gaining weight or becoming obese. In an anorexia nervosus, a person in the pursuit of thinness starts to restrict their diet. A lot of times they will vomit or eat a lot of food, then vomit it up. When they vomit, all of that, there's a lot of guilt and shame in that. But it's also the reason why this is in a circle, it's a vicious cycle. When they feel so guilty, they feel guilty about it, but actually during the stage of purging, there are certain hormones released in the brain that make them feel better initially, and then they start feeling guilty. And then a lot of times that guilt and shame runs into the fact, oh, I need to be skinny, I need to be thin, and then it starts all over again. So just want you to note in this that it is a vicious cycle that's very hard to get out of. So let's talk about anorexia nervosus. The behaviors: you limit your food intake, you limit food varieties, you have unusual food rituals, obsessive behaviors, regular weighing, meticulous food records. So, for an example, unusual food rituals. I worked with a client that had to have all of her foods in certain areas of her plate, and they couldn't touch. So, like, the vegetable had to be on the top left, the meat had to be in the bottom right, everything had to be counted out. So if she was eating beans, she would have 10 beans. So those are unusual food rituals. Most of us don't care what our food looks like on our plate. So let's look at more depth about symptoms and signs of anorexia nervosus. Here's the physical signs are on the left. At or below 50% of the ideal body weight, thin appearance, fainting, dizziness, fatigue, overall weakness. That's due to lack of nutrition. Intolerance to cold, significant loss of body fat and lean body mass, brittle nails, dry skin, dry hair, thinning hair, hair loss, low blood pressure, formation of laringo on the skin, and that is like that real soft, fine hair that babies have on their skin when they're newborn. Women that aren't anorexic will also get that fine hair on their body. Irregular or absent menstruation. Emotional signs and symptoms. Food rituals such as excessive chewing or cutting food into small pieces. Restriction of the amount and type of food consumed. Adherence to rigid daily schedules and routines. Refusal to eat. Denial of hunger. Excessive exercise. Depression or lack of emotion. Food preoccupation. Frequent monitoring of body weight. Tendency towards perfectionism and a rigid attitude. And then health consequences, which we'll talk more in detail, are reproductive problems, loss of bone mass, electrolyte imbalance, irregular heartbeat, bruises, injuries such as stress fractures, impaired iron status, impaired immune status, slow heart rate and low blood pressure, increased risk of heart failure, and increased risk of suicide. Typically with bulimia, a person will just restrict their food. It doesn't come with the vomiting. And oftentimes, a person with bulimia will have a disordered thinking of what they look like, or an unrealistic view of what they look like in a mirror. So if you show somebody with bulimia, a person that is really, really skinny, and a person that is overweight, that person who has bulimia may be way underweight and be very skinny. And probably a lot of you have known somebody with an eating disorder such as bulimia, and they look very, very sickly, and they have sunken cheeks. But when they look in the mirror, they don't see that. They see a person that is overweight. They really do actually see themselves as overweight when they look in the mirror. They don't see themselves as skinny. So that's another sign. About bulimia as opposed to anorexia. They tend to carry out it in secret, often feel shame and guilt, tend to be impulsive and have low self-esteem, and they are more likely to seek treatment than somebody with anorexia. So let's look at a little bit more detail here. The physical signs of bulimia are fluctuation in body weight, swollen or puffy face, odor of vomit on breath or in the bathroom, sores around the mouth, irregular bowel function, induced vomiting after eating. The emotional signs and symptoms, feelings of guilt or shame after eating, excessive concern about weight, repeated attempts at food restriction and dieting, frequent use of bathroom during and after meals, feelings of being out of control, moodiness and depression, laxative abuse, fear of not being able to stop eating voluntarily, disappearing of food in household, and eating to the point of physical discomfort. Your health consequences can be erosion of tooth enamel and tooth decay from exposure to stomach acid. Electrolyte imbalances that can lead to irregular heart function and possible sudden heart attacks, inflammation of the salivary glands, irritation, inflammation of the esophagus that could lead to hemorrhaging and bleeding after vomiting, dehydration, weight gain, abdominal pain and bloating, sore throat and hoarseness, and broken blood vessels in the eyes, which are from vomiting. I worked with a client who would go to the gas station and buy a lot of food, boxes of cookies and crackers, bags of chips, and the parents noticed that, she was spending a lot of money at the gas station, much more so than you would just for gas, and that a lot of times it was late at night. And then the client would come home and eat all of those in one sitting, and then obviously throw them up. But a lot of times bulimics will not keep their food in normal places. They'll hide their food because obviously they're embarrassed about it and they don't want anyone to know that they're doing this. So you'll find lots of food hidden in places like under their bed or in their closets, maybe in the car trunk. That's also a sign of somebody who's hiding their food a lot. Again, if a parent starts to see large sums of money being spent at the grocery store, unusual things like that, that can be a sign that the person has bulimia. And a lot of times with bulimia, it's a way of controlling their weight, but some bulimics aren't really that skinny, so you can't really tell by just looking at them physically from their weight whether they have the disorder or not. But some of them keep enough food in to keep the calorie intake at a level where they're not losing a lot of weight. Okay, in case you missed this in today's reading or this week's reading, I want to read an excerpt from a diary of somebody who is struggling with bulimia nervosis. I was feeling really hungry today, but I kept myself from eating. It is getting harder and harder not to eat. I just need to hang in there. Yesterday I was so good. I only ate 400 calories. I can do better though. Today I'm going to eat only 300 calories. Drinking lots of water helps me feel full, but then I start feeling fat. I hate that feeling. If I begin to feel fat, I can always make myself throw up, and it is worth it. My goal is to lose another 2 pounds by the end of the week. It feels so good to be skinnier. A lot of people have commented that I look too thin. It makes me feel good when they tell me that. It gives me strength not to eat. My goal is to weigh 85 pounds by the end of the month. I really think I can do it. If I exercise a little harder and eat less, I am sure I can get there. I think I should stop eating rice. It's making me fat. My friends don't call me very much anymore. I think they are jealous that I'm losing weight. My weight this morning was 88 pounds. That surprised me because I thought for sure I would weigh less. That is why I'm going to try to eat less today. I can do it! Exclamation mark, exclamation mark. NOS can be characterized by a person that eats excessively large amounts of food in a 2-hour period at least twice per week for at least 6 months. They feels a lack of control over the episodes and experiences feelings of disgust, depression, and or guilt in response to overeating. Other proposed diagnostic criteria could include eating until uncomfortably full, eating more rapidly than normal, eating large amounts of food even when not physically hungry, and eating alone out of embarrassment at the quantity of food that you're eating. So an individual who suppresses his desire for food and avoids eating for long periods of time between is called a restrained eater. While restrained eaters do not meet the specific diagnostic criteria for like a binge for bulimia, there are many similarities. Restrained eaters limit their food intake and fast to lose weight. After extended periods of food restriction, restrained eaters find themselves feeling out of control and respond by binging. The cycle of fasting and binging can be difficult to stop. Many restrained eaters perceive themselves as overweight, and the consumption of large amount of foods generates further feelings of inadequacy and self-control. These feelings can cause restrained eaters to turn back to food for emotional comfort. Like other disordered eating patterns, restrained eaters find themselves in a vicious cycle that results in poor physical and psychological health. Other disordered eating patterns, there's something called an SRED, which is nocturnal sleep-related eating disorder. It's reported when people leave their beds, walk to their kitchens, prepare, and eat food. Individuals may begin to suspect this when they notice unexplained missing food or maybe dirty pots and pans the next morning, and they do not have any recollection of eating. It's more prevalent in women. And then there's also night eating syndrome, which individuals are aware they're eating. They might not feel hungry for the first several hours after waking up, overeating in the evening and consuming more than half their calories after dinner. They have difficulty falling asleep, accompanied by the urge to eat. They wake during the night and find it necessary to eat before falling back to sleep, and feelings of guilt, shame, moodiness, tension, and agitation, especially at night. So those are other some forms. Now, it's interesting to note that some sleeping pills have been linked back to the SRED. So it's important to look at some of the medications you're taking to see if that could be causing the nocturnal sleep-related eating disorder. I did have a client that was put on a anti-anxiety pill and a sleeping pill to help them sleep at night, and it was causing this SRED. It's very bizarre. Again, they have no idea that, and they have no recollection of cooking anything, but he would wake up and see like a whole bag of bacon and a whole thing of eggs missing, and then pots and pans, evidence of him cooking. So that's a really interesting disorder. There is something called food nephobia, which is a disordered eating pattern characterized by an irrational fear or avoidance of trying new foods. Individuals with food nephobia typically eat very limited ranges of food and often adhere to well-defined and unusual food rituals and practices. For example, an individual with food nephobia may refuse to eat foods made from 2 or more food items. He may enjoy certain foods when eaten separately, but may find them disgusting when joined together. In adults, these types of behaviors can be socially restricting and embarrassing, and in extreme cases, they can lead to nutritional inadequacies. People with food nephobia tend to be slightly overweight because they are often limiting themselves to comfort foods that are high in calories, such as hamburgers, french fries, or macaroni and cheese. Then you have something called muscle dysmorphia, and a lot of times this happens more in men than women. It is primarily in men who have intense fear of being too small, too weak, or too skinny. So behaviors associated with this include working out for hours each day, allowing exercise to interfere with family and social time, paying excessive attention to diet, and maintaining unusual food rituals and eating practices. People with muscle dysmorphia may also engage in health-threatening practices such as the use of anabolic steroids to gain muscle mass. One study reported that 1/3 of men diagnosed with muscle dysmorphia had also a history of eating disorders. So they can also binge and purge. To compensate for insecurities, they are driven to achieve overtly strong-looking bodies, affected by excessive thoughts of being weak, insecure, and vulnerable. Men with muscle dysmorphia can have difficulties maintaining personal and social relationships. Briefly at the beginning about socio-cultural factors that might influence. Obviously, we have abundance of food in the United States. I mean, it's everywhere. When you go to the mall, every entertainment venue has food. We're just surrounded by it, and I think that's part of the problem. Then we just value thinness. We, for some reason with social media, it has really, I think, warped a lot of our definitions of what health is. I'm just going to read something because I think this is very interesting and very relevant. Based on popular media images, a perfect body is tall, lean, and has well-defined muscles. Whereas the average woman is 5 foot tall and weighs 140 pounds, the average model is 5'11" and weighs 117 pounds. This discrepancy has become more pronounced as female fashion models, beauty pageant contestants, and actresses become increasingly thinner over the years. And this is interesting to note. When the Miss America beauty pageant first began in the 1920s, its contestants' body masses were averaged to be about 20 to 25, which is kind of a nice, healthy body fat range. So today, nearly all the participants have a BMI of less than 18%. In fact, a recent study reported that women who participated in beauty pageants as children were likely to experience body dissatisfaction, interpersonal distrust, and impulsiveness than those who didn't. Eating disorders. Well, studies have shown that family dynamics can play a part. Because parents influence nearly every aspect of a child's life, it should come no surprise that this can happen. In fact, studies have shown that parents that are overprotective, rigid, they avoid conflict, might be abusive, chaotic families, and the presence of a mother having an eating disorder also puts you at risk for developing an eating disorder. One thing I would like to add here is I've noticed with the clients that I've worked with over the years that have had eating disorders, a lot of times their parents put a lot of pressure on them to strive for perfection. So that was something that I want to point out. Another thing I've learned from working with clients is sometimes when families are out of control or there's aspects of their life that's out of control, eating or having a patterned way of eating is something that person can control. And so a lot of times they will turn to that in order to control one aspect of their life because there are other things going on that are so out of their control. Another thing I want to point out, I've noticed a lot of people that I've worked with that have eating disorders have also suffered some type of sexual abuse. So all these things can lend itself to an eating disorder. But also biological and genetic factors can play a part. If a person suffers from depression, they're more likely predisposition to have an eating disorder. Athletes tend to be competitive people and may equate their self-worth with athletic success. They may be especially willing to engage in risky weight loss practices to achieve that success. Coaches and trainers who believe that excess weight can hinder performance may ignore unhealthy behaviors and even encourage them. According to the NCAA, the sports with the highest number of female athletes with eating disorders are cross-country runners, gymnastics, swimming, and track and field. Also want to add cheerleading into that. Sports with the highest number of male athletes with eating disorders are wrestling and cross-country running. The female athlete triad is a combination of 3 interrelated conditions: disordered eating or an eating disorder, menstrual dysfunction, and osteopenia. Osteopenia is a cessation of menstruation leading to low bone density and increased risk of stress fractures, and also, obviously, an increased risk of infertility. So these are 3 things that can happen as a result of a female athlete not eating correctly. This shows menstrual irregularity and stress fractures in collegiate female distance runners. So you can see there it's pretty high. So how can an eating disorder be treated and prevented? First of all, it's really important to seek professional help, whether it's a counselor or a hospital. Somebody who's suffering with the eating disorder usually can't get over it on their own. It's like telling an alcoholic, you just stop, stop drinking. Well, we all know that we've had alcoholics in our family or have dealt with that with friends, that it's just not that easy. A lot of times there needs to be a treatment plan put in place and the help of a professional. The treatment goals are to enjoy food without fear and guilt and to respond to physiological cues of hunger and satiety, to just recognizing when the body is full. There are also great programs to help with overall self-esteem, since that plays such a huge part in somebody succumbing to an eating disorder. And obviously the treatment strategies are going to vary according to the eating disorder. I just want to take a brief minute to talk about promoting a healthy body image among children and adolescents. This is really important for those of you that have children. A lot of times we think what we do just affects ourselves, but as we have children, we know that it also indirectly can affect our kids. And it also starts with youth. If we can train children and adolescents to think correctly about their body, then they're going to have a less likely chance of developing an eating disorder. So here's some things I just want to go ahead and read line by line. Encourage children to focus on positive features instead of negative ones. Help children understand that everybody has a unique body size and shape. Be a good role model for children by demonstrating healthy eating behaviors. Resist making negative comments about your own weight or body shape. Focus on positive, non-physical traits such as generosity, kindness, and a friendly laugh. Do not criticize a child's appearance. Never associate self-worth with physical attributes. Prepare a child for puberty in advance by discussing physical and emotional changes. Enjoy meals together as a family and discuss how the media can negatively affect body image. Avoid using food as a way to reward or punish. Okay, and that wraps up our session for today. If anybody is struggling with an eating disorder or would like more information on how to get help, please feel free to contact me and I will direct you in the right path to getting help for you or your loved one.